hypomethylating agents are the most common used modality for patients with high-risk MDS. So in the US, they are approved for patients with both higher and lower risk MDS, but we often don't use them except in high risk MDS from the get-go, or in some patients with lower risk MDS when they stop responding to some of the less invasive procedures such as erythropoiesis-stimulating agents. So the two forms that we have are azacitidine and decitabine. Both of them are given by injection. So azacitidine can be given subcutaneously or intravenously, while decitabine is only given intravenously. And because of that, the patients will often need to have an access, like a small catheter, to give them the drug, or they have to have repeated injections. Both of those drugs are given for multiple days each month in a row. So usually you give them 5 to 7 days. So that requires frequent trips back and forth to the infusion center. The side effects are generally minimal. Most patients will not have severe side effects. The most common side effects are fatigue, maybe some GI upset, some nausea, some local reactions at the site of the injection with the sub-Q azacitidine. Rarely you can have severe, toxicity related to organ damage, but that's very rare. Other common side effects are, of course, low blood counts. Those could be difficult to differentiate if they are related to the hypomethylating agents or they are related to the underlying MDS. But generally, thrombocytopenia, neutropenia are side effects that are associated with the use of those agents. However, we give them routinely to patients in their 70s, 80s, and I would say the vast majority of patients tolerate them quite well. In terms of efficacy, those drugs have been associated with complete responses. The average response rate, if you look across trials, overall response rate is maybe in the range of 40 to 50% for overall response rate. For complete remission is somewhere between 10 to 15% for complete responses. So more than half of the patients will not respond, and the responses can take several months to occur, 4 to 6 months, which is quite long to treat the patient for 4 to 6 months before you know for sure whether they are responding or not. And there is some improvement, of course, in quality of life and transfusion independence. But in terms of survival improvement, azacitidine is the only HMA that has been associated with overall survival improvement. In the landmark is a 001 trial in which the median survival was around 24 months. However, we and others have shown that at the population level, the real survival with those agents is probably in the range of 12 to 16 months. So I think that tends to be more a realistic estimate that I provide when I discuss the use of those agents with patients. I think one of the bigger challenges with the use of hypomethylating agents is the fact that they have to be given by injection, either subcutaneously or by infusion. The patients have to come frequently to the clinic back and forth, so 5 to 7 days in a month. And you have to remember again that those patients are older, so their social support is generally often limited because their spouse could be sick or disabled, or cannot drive them back and forth. And in many times, unfortunately, the patient could be widowed, as their children have moved out of home, and many times they're out of state, and their friends are older. So sometimes many of those patients do not have anybody to drive them back and forth. So that could, in my experience, could lead to some patients declining to be treated because they just cannot find a way to come frequently back and forth to get the injections. And sometimes they elect to be treated closer to home. Luckily, those drugs are FDA approved, so they can be given by the community physician. But often when we need to put a patient on a clinical trial that has an HMA backbone, sometimes the patients cannot go on clinical trials even if they want to, because they cannot go back and forth to the big center that frequently for the azacitidine or decitabine injections.